Here's what you need to know about the new CDC guidelines for recommended vaccines for kids. There are now fewer shots on the list and is facing pushback from doctors and public health experts. Under the new guidelines, the CDC recommends all children be vaccinated against 11 diseases, a decrease from the 17 immunizations. Some, including those for hepatitis A and B, meningitis, rotavirus, and seasonal flu, are recommended only for those at high risk or after talking it over with a doctor. President Trump announced the change on Truth Social, saying in part, quote, "This schedule is rooted in the gold standard of science and widely agreed upon by scientists and experts all over the world. Effective today, America will no longer require 72 jabs for our beautiful, healthy children." 72 jabs sounds high, but that number factors in every annual flu shot and COVID shot through age 18. The American Academy of Pediatrics is condemning the change, calling it both dangerous and unnecessary, and they say they will continue to publish their own vaccine recommendations. I spoke to pediatrician Dr. Amanda Kravitz with Weill Cornell Medicine, who says the new categories are even confusing for doctors.
The documentation really didn't come out with information about what the high-risk category even is. They used an example of children with lung disease, but it's really leaving it up to the doctors to determine which children would qualify for which vaccines.
And I asked about federal health officials saying this change puts the U.S. in line with other countries like Denmark.
I think it's an important thing to note that vaccine schedules are not one size fits all. And by that I mean, just because something is working in Denmark does not mean it's going to work in the United States. The USA is a very, very unique country. We have 50 times the population compared to that of Denmark. So what's working in Denmark is probably not going to work in the United States. The population needs, the illnesses that are affecting the children and the population of the USA are different than that of Denmark. And so we can't just say, well, we like what they're doing there, so we're going to adopt it in the US.
Health and Human Services Secretary Robert F. Kennedy Jr., a longtime vaccine critic, said in a statement that Monday's announcement protects children, respects families, and rebuilds trust in public health.